Hello, guys. Welcome to another episode of the Anti-Pharmacist podcast. How was your weekend? Well, it was a busy weekend for me somehow, but I got to rest on Sunday. So, I've got good news, guys. I got it in the mail and it makes me so happy. So, your support has gotten Anti-Pharmacist podcast to number 9 health podcast on Apple Podcasts. That is good news to me, all right? I've learned to celebrate my small wins, and this will help me appreciate even when the bigger one comes. And I want to use this opportunity to thank you, my listeners, for being with me from the beginning. We've been hearing for over a month now, and I'm just so grateful for the audience. I see your consistency, I see the comments, I see how you share them, and I want to encourage you to do more. We can get to number 1 podcast worldwide. I know we can do it, guys. Thank you once again so much. So, my topic for today, let's see. I have a lot of issues to discuss, right? This is one other one that I believe that you need to know about, all right? It is that one question that you always ask your pharmacist when you get your drugs from the pharmacy. You go like, when will it start working? When will I start seeing the effect of the drugs, and other likely questions? In other words, what you're asking is the onset of drug action. Well, I'll be answering that question today. Isn't that just great? So, let's get right into it. And yes, lest I forget, I mentioned that I had kata on Friday, right? Well, I'm much better now. Thank you. So, back to my topic, onset of drug action. First, in order for my explanation of onset of drug action to make sense to you, I'll have to explain briefly what happens to a drug when you take it. Drugs come in different dosage forms, like the oral form, which can be liquid, that is the syrups, the solutions, the suspensions, the tablets, the capsules, powders, lozenges, and the likes. There is also the injectable forms, that is the ones that are passed directly into the body, either through the veins or muscles or other means. These two are the common routes of drug administration that most patients are familiar with. If you don't take oral, you say you are opting for injection. But there are others, like the subcutaneous route, that is under the skin, the intranasal through the nostril, the sublingual, which is under the tongue. There's also the topical route, that is those drugs that are placed directly on or into the affected area, like the eye and ear drops, for example, like rubs and ointment and gels and many others like that. Now, the onset of drug action depends on this route of administrations that I've talked about, which is why I explained them first. The effects of injections are felt almost immediately, especially the intravenous injections, because they are passed directly into the bloodstream. But for intramuscular injections, they have to pass through the muscles to get to the receptors at the site of action before their effects can be felt. There are lots of scientific technicalities involved when you take a drug into your body. And trust me, you don't want to be bothered with all of that, which is why I will skip the technical ones and make the relatively simple ones even as simple as possible and explain using the most common route of drug administration, which is the oral route. So regardless of the dosage form, whether tablets, capsules, syrups and the likes, the process is almost the same. Your drug has to pass through different processes in your body in order for it to elicit any action. Like I said in an earlier episode about composition of your drug, especially the tablets, I remember that I mentioned and explained about the active pharmaceutical ingredients and excipients, and said that the active pharmaceutical ingredients are the active substances in your drugs. This API has to be released from your tablets or capsules in order for you to actually feel its effects. So your drug undergoes absorption, distribution, metabolism, and excretion. Don't worry, this is not about to become a pharmacology class, alright? I said earlier that I will not go into too much details. Just know that the period of time between when you swallow your medication and when it is absorbed after the API has been released from the matrix of the other substances in the dosage form, coupled with how fast it gets distributed by the blood and it reaches the site of action in adequate quantity that can elicit action, is what determines the onset of action. Should I say that again? Don't worry, you can listen again. Just rewind, alright? Typically, Onset of action of most oral medications is 30 minutes. Most, like I said, there are exceptions, alright? It can even be shorter, like for syrups and suspensions, because those ones do not have to undergo disintegration first, unlike tablets. If you take a tablet of paracetamol, for example, for headache, you should feel relief at most after 30 minutes of taking it. It can even be quicker than that, depending on if it's a caplet or a tablet. Same applies for most pain relievers, even capsules. Now, when it comes to anti-infectives, that is drugs used to treat infections, the dynamics is a bit different. Onset of drug action does not only depend on time of absorption and extent of distribution. Even if you take injectables, the onset of action can be as obvious as when you take pain relievers, because in this case, the relief of symptoms is also dependent on the number of microorganisms you are able to kill or inhibit, and it doesn't just happen in minutes or even a day. However, you may start seeing your symptoms subside after 2 or 3 days, and this is when the disobedient patients stop taking their medications, thinking the issue is resolved. Remember, some episodes back, I talked about maintaining blood levels of medications and half-lives and all of that. You should endeavor to use your medications for the instructed number of days to ensure complete eradication of microorganisms. Don't mistake onset of action for total cure of ailment. Also, do not forget that your medication working at all depends on you taking it as prescribed or as recommended, that is, at the appropriate intervals, or else, no show. I feel like I am repeating myself a lot, bringing back what I have talked about in the past episodes. But the truth is, these topics are all interwoven, they are connected, and that's the beauty of it. Besides, it is for your own good, in the sense that if you remember a topic, for example, you will most likely remember another one related to it. I said onset of drug action can be affected by many factors. Well, I will talk about two of those factors because they are quite important. Not that others are not important, but these ones are largely dependent on you. The first one is tolerance, while the second is antimicrobial resistance. Yes, these are the two factors, two major ones that concern you, that your onset of drug action depends on. I have also talked about these two on episodes before about medication adherence. Tolerance, in terms of pain relievers or antihistamines and the likes, that is, those medications that are not really working against any organism. And antimicrobial resistance, when it comes to medications used to stop the growth of or kill microorganisms. If you are used to abusing these medications, that is, you haven't been using them the right way, you take them anyhow, and you stop taking them at any slight sign of relief when you are actually supposed to continue, then your onset of drug action will be prolonged, or it may not work at all until you double the dose or use a more powerful medication or another dosage form entirely, usually injection. That's why some people will take tablets. When they do not take it well, they say, it doesn't work for me. I went to the hospital and they gave me drip. They gave me injection. That's because that one, you don't have to observe any interval by yourself. They pass it directly through your veins to your blood. Or maybe they inject you and it passes into your body through your muscles. Another factor that actually influences the onset of drug action is the chronicity of the condition you're treating. Alright, some people start taking antihypertensives, for example, and in 2 days they want to see a difference in their blood pressure. It doesn't work that way. Or you're taking antidiabetics and in a week you want to see significant drop in your blood sugar. No, because this illness is a chronic one. It didn't just start today, so you have to give it time. You have to give your body time to get used to that blood level of drug, then for it to start eliciting its effect. Alright, that's why for steroids, for example, in some acute inflammatory conditions, they work fast, you see the inflammation go down, but in other more chronic conditions like systemic lupus erythematosus SLE, like rheumatoid arthritis, you may not see the effect immediately, even if you take higher doses of those steroids. I hope you understand what I'm saying. So, the summary of my story today is that When you take a medication for whatever ailment, don't expect it to work immediately. It's not magic, guys. It must go through some processes, part of which I have discussed in as simple terms as possible. And it also depends on some factors that I have mentioned before you can feel its effect. Give it a day or two of consistent use, and then you feel the effect that you've been looking forward to. Let me quickly mention that there are some drugs whose onset of action take weeks. They accumulate in the body up to a level at which the cumulative effect will be felt at once. When you are getting these types of medications, your healthcare provider will definitely inform you of this peculiarity. But for most conventional drugs, it is as I have said earlier, a day or two, and you will see your health well on its way to being restored. So let me just give you rough estimates based on dosage forms. For syrups, suspensions, and solutions, expect faster onset of drug action, maybe between 20 minutes to 1 hour, depending. And for tablets, for capsules, for caplets, between 30 minutes as well to 1 hour or less, even. For inhalers, within minutes, within 2 to 3 minutes, because of the route of administration, is going directly to your lungs, your alveoli. For injectables, almost immediately, within minutes, you feel relief, like the IV and the high hem as well, although the IV is shorter than the high hem. Then there are some that come as depots. Those are released slowly into the body, like some contraceptives. The effects will accumulate over time. So those are the not so specific, but at least in the premises of the onset of action of the various dosage forms, at least the commonly used ones. Sublingual to us relatively faster onset, even faster than oral. This doesn't mean you can't still ask your pharmacist again, or when you get to your pharmacy, that when should I expect to feel relief? When will it start working? I'm sure that they'll be able to answer you. And if you do not get your answer, well, I've answered you here. This brings me to the end of today's episode. I hope that you have been able to gain a thing or two. Once again, I want to appreciate you for following this podcast up to this point. Thank you so much. Your encouragement has kept us going this far, and I'm sure that it will keep us going even in the future. So, we are on social media, on X, on Instagram. Please do well to follow and engage us. DM us. You can also email us via antipharmacistpodcast@gmail.com. Listen, like, follow, subscribe, and share this podcast to as many people as you know need drug information. And in truth, that is everybody. Enjoy the rest of your week, and I'll see you next time. Till then, stay healthy and God bless you.